The US healthcare system has been the subject of much criticism for many years, with experts and patients alike pointing out its many flaws. There are a number of reasons why the US healthcare system is widely considered to be one of the worst in the developed world. In this answer, we will explore some of these reasons in detail, drawing on information from various sources. One major problem with the US healthcare system is that it is incredibly expensive compared to other developed countries. According to data from the Organization for Economic Cooperation and Development, OECD, the US spent 16.9% of its gross domestic product, GDP, on healthcare in 2018, which is nearly twice as much as the average OECD country. The second highest ranking country, Switzerland, spent 12.2%. At the other end of the spectrum, New Zealand and Australia devote only 9.3%, approximately half as much as the US does. 1. Such high healthcare costs can lead to financial hardship for many Americans, particularly those who are uninsured or underinsured. Another major problem with the US healthcare system is a lack of access to care. Millions of Americans are uninsured, and even those with insurance may find that their coverage is inadequate. This can lead to delays in care, unnecessary suffering, and even premature death. A study published in the American Journal of Public Health found that lack of health insurance was associated with nearly 45,000 deaths in the US in 2005, too. In addition, many Americans live in healthcare deserts, or areas where there are few or no healthcare providers, which can make it difficult to obtain care even for those who have insurance. In addition to high costs and lack of access, the US healthcare system also suffers from poor quality of care. Despite spending more on healthcare than any other country, the US ranks last among comparable countries on the Healthcare Access and Quality (HAQ) index, with a score of 88.7, compared to an average of 93.7 for comparable countries in 2016. 3. This poor quality of care can manifest in a number of ways, including medical errors, poor coordination of care, and overuse of certain treatments. One contributing factor to poor quality of care in the US is a lack of coordination between different healthcare providers. Patients in the US tend to receive care in a variety of settings that may have little or no connection to each other. This can lead to duplication of care, poor coordination of services, and higher costs. A doctor may prescribe a medicine that has dangerous interactions with other medicines the person is taking, for example. 1. Another issue with the US healthcare system is that it is heavily influenced by powerful interest groups, such as insurance companies, pharmaceutical companies, and medical device manufacturers. These groups have a vested interest in maintaining the status quo and may lobby against reforms that could reduce their profits. This can make it difficult to enact meaningful changes to the healthcare system. There are a number of potential solutions to the problems facing the US healthcare system, including expanding access to care, reducing healthcare costs, and improving quality of care. Some proposed solutions include implementing a single-payer system, increasing government regulation of the healthcare industry, and investing in preventive care and public health initiatives. However, implementing these solutions will likely require significant political will and may face opposition from powerful